Since the start of the epidemic, over 40 million people have died from AIDS. But today, we have the tools to end it. So why is it still around? HIV is the virus that causes AIDS. AIDS, or acquired immunodeficiency syndrome, is a condition in which the immune system becomes severely weakened due to HIV infection. HIV infection refers to being infected with the human immunodeficiency virus. AIDS is diagnosed when a person with HIV develops certain opportunistic infections or specific illnesses that occur as a result of a weakened immune system. What are the stages of HIV? Stage 1. Seroconversion illness. The primary infection stage only lasts for a number of weeks, during which the person may suffer from flu-like symptoms such as fever, upset stomach, sore throat, or muscle pain. About 1/5 of people would suffer enough to see a doctor, but HIV is rarely diagnosed on this alone. At this point, the immune system is starting to react to the virus by producing HIV antibodies and cytotoxic lymphocytes, a process known as seroconversion. A third-generation HIV test carried out before this process is complete, may be negative or inconclusive. Stage 2. Asymptomatic stage. Aside from swollen glands, a person is largely symptomless at this stage and often starts to feel better. On average, this asymptomatic stage lasts for around 10 years, but can last up to 15 years. HIV antibodies can now be found in the blood, and therefore an HIV test will give a positive result. HIV is active within the lymph nodes at this time, infecting new cells and making copies of itself. A viral load test measures the small amount of HIV which gets away from the lymph nodes. This information is very important in the treatment of HIV. Stage 3. Symptomatic stage. The immune system becomes seriously damaged by HIV over the years. The lymph nodes and tissues are damaged or destroyed. The body cannot continue to replace the lost T helper cells as the HIV infection becomes stronger and more varied. Symptoms develop as the immune system fails and may include weight loss, chronic diarrhea, night sweats, and fever. The symptoms worsen as the immune system starts to slow down. This is the time when infections known as opportunistic infections and cancers can occur. Stage 4. Late-stage HIV. When the immune system becomes increasingly damaged and the illnesses increase in frequency and severity, an AIDS diagnosis is given. AIDS stands for acquired immunodeficiency syndrome, a potentially life-threatening condition. The body's ability to fight infection and disease is severely weakened due to immune system damage. So what should you do if you're infected with HIV? 1. Antiretroviral therapy, ART. The primary and most effective treatment for HIV is antiretroviral therapy, ART. This involves taking a combination of HIV medicines called an HIV regimen every day. ART does not cure HIV, but helps people with HIV live long, healthy lives. When the virus is undetectable, it cannot be transmitted to others sexually. 2. Early treatment is key. Starting ART as soon as possible after diagnosis improves health outcomes. 3. Consistency is crucial. People living with HIV must take their medication every day. Missing doses can lead to drug resistance. 4. Regular monitoring. Patients undergo routine blood tests to monitor viral load and CD4 count. 5. Supportive care. Psychological support, nutrition, and prevention of other infections are also important. Thank you for watching.